Hi everyone, I am Dr. Hidayatullah, urologist in TX hospital. Today we are going to discuss or tell about something about prostate gland. Prostate gland is one of the important organ in males where it is present below the bladder. So, in these patients, some after 50 years, males tend to present with some symptoms like frequency, again and again they will be going for urination, nocturia, at night time they get up to pass urine, urgency, they will have urgency means they can't hold the urine, they will have constant urge to void, and incontinence, sometimes they even pass urine in their clothes. This is similar to the females presenting with uterine problems. See, in females after 50 years uterine problems will be more common, in males prostate problems will be more common after 50 years. But it does not mean that all the patients with prostate enlargement require treatment. Patients with enlarged prostate, bigger prostate sometimes will develop all these symptoms. So, depending on their severity, how much severe their symptoms are, we score these patients. Their symptoms in mild category, their symptoms in moderate category, their symptoms in severe category. If the symptoms are mild category, then we advise them lifestyle changes, and lifestyle changes like decrease intake of beverages, if they are alcoholic, decrease the content of alcohol, daily intake of alcohol, and water intake, what is the quantity of water intake per day, we will assess that and advise him according to his requirement what quantity of water he has to take. And if they are smokers or they have any other habits, we tell them avoid that. These are some of the lifestyle changes, exercises. Next is moderate symptoms. If the patient is having moderate symptoms, then we suggest them medical management. We have very good medicines nowadays with less side effects. We prescribe them alpha blockers by which the prostate to some extent will shrink and decrease their symptoms. If the patient is having severe symptoms of prostate, then we suggest them to go for surgery, or if they are not responding to medicines, then we suggest them to go for surgery. If the patient is presenting with retention, means he is not able to void urine, then we suggest them to go for surgery. So, what are the investigations which we suggest to these patients with prostate? One is ultrasound scan. We want to know what is the size. Normally in younger age group, the prostate size will be 10 to 15 cc. Young means 20 to 30 years, 40 years age group. After 50 years, the prostate tend to enlarge. It can enlarge to 100 cc, 150 cc, and we sometimes see 250, 300 cc prostates also. So, these patients with enlarged prostate, if they have symptoms, then we suggest them to get some investigations. One is ultrasound, another is serum PSA, prostate specific antigen, where in some patients if it is elevated, then it suggests that he might be having, to very less extent, some patients may have prostate cancer, some may have urine infection, some may have prostatitis because of elevated serum PSA. Next is complete urine examination. How is his urine? Is he having any urine infection? What is he passing blood in urine? These are some of the information which we get from these tests. What is the surgery we suggest to these patients is, we have laser, holmium laser, TURP, bipolar TURP, monopolar TURP. There are different methods with which we can do surgeries. If it is very big, sometimes we need to do open prostatectomy. These are some of the options which can be suggested in these patients. Thank you.